Hi guys, today I'm going to talk about diabetics and how to reverse it. There are a lot of young people who are getting diabetics, and like it is very painful to see them suffer from diabetics. So I'm trying to help as much as possible here. Uh, to fix and reverse diabetics, we need to understand how it is caused. The reason for this video is I was able to reverse diabetes for my mom, like who had diabetics for 20 years, and like I was able to help her reverse diabetes in probably 3 to 6 months. So, and got her out of all the medications related to diabetics, related to blood pressure, and related to cholesterol. Like all these things comes combined. Once you have diabetics, you will have all the other side effects coming into picture, and I will go deep into those things. So how, like, what is the cause for diabetics? So diabetes is caused by continuous production of insulin, resulting in reduced insulin sensitivity and end up in insulin resistance. So the capacity of the food to trigger insulin is measured by glycemic index. So to help you conquer diabetics, you have to consume foods that are low in glycemic index, the better. And like I will recommend to have zero glycemic index foods. So yeah, so like if you take the classes of foods, carbohydrates, proteins, and fat, carbohydrates has higher glycemic index and it triggers more insulin. Protein is lower, but like it still has insulin, still trigger insulins, and um, fat has zero insulin. So it is better to consume protein with fat, which is in the form of meat, eggs, or other whole proteins with fat, nuts, instead of processed whey products. um, so like protein consumed with fat is proven to reduce insulin trigger, means it has less. So like when you are continuously eating carbohydrates results like will trigger insulin, like for that sense, like for any processed protein as well. So which will result in storage of fat around your body. First the body starts to store in tummy, like in your buttocks, and it keeps on storing. And then like at some point, right, where your cells are surrounded with fat, and like your body started to need more insulin to convert food, uh, and cell are getting resistant to insulin. Essentially you need more insulin to properly use the food that you are consuming. This stage is called pre-diabetics, and at this point in time, like people put on a lot of weights, because they need more insulin. Your body secretes more insulin, and more insulin will result in more fat storage, and so your body starts to store fat, and you will be in the pre-diabetes stage. And then like with the insulin resistance, your body is not able to properly use the digested food, and send it to cells for metabolism. So what it does is like it started to storing around your organs and things. um, so when it started to store weight around your organs, um, your abdominal area started to increase. So and like body has a mechanism, like defensive mechanism, which will always measure what's the amount of sugar we have or glucose we have in your body, and which will always measure what's the amount of insulin in our body. And then it will try to make sense of like whether we need to produce additional insulin or not. So continuously, if your body has high sugar, it should have continuously increase the insulin production, right? And at some point it will check what's the amount of insulin there, and it will notice that the amount of insulin is not reducing because the body is not able to properly use the insulin. And what happens is like our brain tells the pancreas like stop producing insulin. He has need more than needed insulin in his body. So this is common for any of the hormones, right? So if you have more than needed hormones, like either externally or internally, your body is going to shut down your own production. So that is what happening, and people will go move on to the stage of diabetics. This will result in high level of glucose in the blood, which is like the blood glucose will never go down, which will lead to blood pressure, blurred vision, weight loss, etc., etc. And external insulin or medication is going to further degrade this experience, because external insulin or medication needs to store the fat somewhere. Your cells are already resistant to insulin, so you either need more amount of insulin and to send energy into the cells, and you also, like, even with lower amount of insulin, your body starts to look for alternate places to store the fat, which is essentially your liver, which will become fatty liver, and your organs, and the capacity of your organs started to will start to reduce. And the other things it does is it starts to store fats in the nerves, right, which will result in, like, it's kind of pipe for blood to circulate, right? So when it starts storing there, like, your blood is not going to have the same flow. So increase the flow, your heart starts to pump more blood, which will increase your blood pressure, right? Since your blood vessels are blocked or, like, occupied with fat, and then, like, your body starts storing fat in your heart, which will result in heart attack and heart arteries, right? And then your body will start to store fat in brain nerves, which will result in stroke and other conditions. And the other thing is, like, when you have diabetes, your body will start store fats in the nerves to the penis. So essentially what happens is, for your erection to be proper, your penis need blood supply, a lot of blood supplies, right? So when you are in diabetes, it's not going to happen, so you will have erectile dysfunction problems. So all these conditions are coming as a part of it's very important that uh, we try to understand the basics. So we have to reverse the process. So like, long term usage of diabetics medication will result in be damaging the liver, because liver is our chemical factory, and it processes all the things that you are putting in, means all the medications you are sending in, and slowly the liver will get damaged, and you already have fat in the liver. In addition to that, you are sending all the chemicals to the liver, which will further damage the liver. And the continuous consumption of medication and, like, high blood glucose level will result to neurological damage, so Parkinson and Alzheimer's and other things. There are ways to prevent Alzheimer's. People are saying that Alzheimer's is genetic. I will like to prove it in the later video that it can be prevented. And so, like, yeah, in this video, hey Stanish, you are saying all the things that are scary uh, related to diabetics. Do we need to worry about it? Do you have diabetes? If I have diabetics, yeah. So, like, why I'm sharing this is to get understanding of how bad it can be, and like, going with the fix, like, how easy it's to reverse diabetics, right? So, like, by doing small changes in your lifestyle, if you can able to reverse diabetics, all these effects will go away, right? People when go to doctors, like, they are treating for individual problems, right? Like, if you're going for a stroke, they will look at your brain, they will give you stroke medicine, but essentially they doesn't know the root cause. The stroke is coming from diabetics. Same way, like, if you are going for a heart attack and you are a diabetic patient, right, they are going to treat you for heart attack. They are not going to treat you for, like, preventing diabetics so that you never get a heart attack, right? So what I'm going to do is, like, I'm going to tell you how to prevent it. So essentially, you have to reverse the process of, like, how you got into diabetics. You got into diabetics by frequently triggering the insulin. How you can reverse diabetes is, like, um, like, stop triggering the insulin. So how will you stop triggering the insulin, but still you have to consume food and live, right? So that is where, like, fat comes into picture. Fat is a high potential energy source, right? That is where keto diet comes into picture. Fat has zero trigger on insulin, unless your fat comes with some amount of protein which will have a minor trigger, but your pure fat has no trigger on insulin. Ketone is like very good for your brains. It's neurologically, ketone has a lot of benefits, and ketone helps with epilepsy, ketone helps with sleep, and slowly ketone will help with your mood improvement, like you will start to feel less hunger, right? So one of the reason for you feeling hunger itself is hunger is coupled with insulin. So when you are consuming a lot of carbohydrates foods, and when you are secreting more and more insulin, there is a high probability that you are getting hungry frequent, which will result in you eating more. Whereas if you move towards ketosis, your insulin triggers reduces, so you will feel more full and less hungry, as well as you are consuming fat which is more in calories, and it will help you feel fuller, better, longer. So, and also, like when you are kicking into ketosis, your body will also start to burn your own fat, which is the fat essentially is stored around your cells and stored in your organs or anywhere in your body, right? And also for burning those fats, your body will produce fat burning hormones, which are testosterone, growth hormones. This will clean up the fats around your cell slowly. When you are continuously in ketosis, it cleans up the fat around your cell, it cleans up the fats from the liver storage and everything, right? Because there is no insulin, like there is less of fat storage, and your body is running on ketones, and it's called ketosis. So this will your insulin sensitivity improving. So your body will realize that your body now can use insulin if it has to produce it. And even if a small trigger for insulin coming from your protein, now the body will send a message, hey, he doesn't have much blood sugar and insulin, can you start producing insulin? So that is how you reverse uh, your diabetes. You have to let your body know that you have a need for insulin, and you can reuse things, you can use your body can use the insulin. So body measures both the things. So I'm going to share you what I followed for my mother to reverse insulin. Like please consult your primary physician or doctor, and proceed with your own judgment. And Yeah, start a keto diet plan. Please research on all the keto foods. Right, I will talk about keto foods later in other videos. I will go into details of each and every food. So what you have to be ready to take diabetics or glucose level checks 3 to 4 times a day, right? Most probably around after each of the meals. Like take one in the morning, and if you're planning to have three meals, three keto meals, have three keto meals, and see how your blood sugars levels are after consuming food 1 hour, probably 1 or 1.5 hours, right? You can use 3 tests. You can slowly reduce the number of tests. Once you feel that your blood sugar is very stable with keto, you can reduce the number of tests, and then you can stick with one test, right? And after continuously monitoring for 3 months or something like that, you can say that, hey, my blood sugar level is not increasing day by day. Like then you can stop taking tests or take tests once in a week. So this is how you have to play in reversing the diabetes. And when you have some doubts with the food, use your data, check your blood sugar level, how is it reacting to food you eat. And if it is spiking with the food you eat, then you should consider avoiding those foods, and uh, consider something new. So it is a slow process, and each and everyone's body might be different. So some body might trigger insulin for certain things, and some might not. That is why I want you guys to, even if you believe something is keto, but your body triggers insulin or your sugar level rises, then there is something wrong. Either something bad is in the content or something like that. So you will start noticing improvements in your blood glucose level, and you should be able to reverse your diabetics in 3 to 6 months. And please share your comments, please share your progress in the comments. Please subscribe to this channel, and I will talk more about each of the benefits of each of the food in details, and what you can consume, and what are the things that you can follow to keep your physical and mental health up. I think that is pretty much for today's video. uh, Bye bye guys.